Okay, so when you log into the iPad and go to the ACPlus application, you want to sign in with your registered name and password. If you've forgotten your password, you'll note forgot password, go ahead and click on that, and you will be able to change your password. And once the correct password has gotten in, you will hit login. So you're going to select your facility. So you will note this is an ACP iPad. So Dan is going to go into our sandbox, which is ACPlus. So you'll select the facility. So pick active versus sandbox. Remember ACPlus in front of the facility name equals the sandbox. If you have EMR, whether it's PCC or matrix care, your facility or company is responsible for the request of this integration, and it does take 7 to 10 days. Once you are integrated into the EMR system, all active patients in the facility will be available for viewing. Okay, and so you can just see as we're scrolling down, these are just practice patients. These are, people that we've been using it on in demonstrations. So if you are adding a new patient, brand new patient, not in the system, you will go to add patient at the top. And please note the red asterisks are required fields. Okay, so name, last name, gender, date of birth, the admission date, these are all required fields. You will save that information. In this demo, Dan is just going to back up since we're not going to be adding a new patient, but if you need to add a new patient, you will just click on the add patient. Okay, so we are going to go next to, we want to do an ARA assessment. You're going to go to the bottom right-hand plus icon. This is what we call the Quick Connect button. Okay, so Quick Connect. You will select your patient. And I'll tell you that if you forgot to select your patient and you just went to the ARA icon, the platform does remind you to select a patient first. So we're just going to wait for the patients to load. And then Dan will select the patient who's being used today, ACP patient. The next thing will be the third icon in that looks like a little spirometer and it says ARA. This is your ARA icon. So you can go ahead and click that. Please scan devices. Now, this should not be an issue in your facilities. Dan just has one at home, so his is coming up. If there were 6 ACP people in the room and we all had our spirometers, they would all come up and you have to choose which one you want to connect to the system. So this is generally not a problem for our facilities. They generally only have one MIR. So you can find the serial number on the white part portion of the spirometer, but you're going to now click connect. So now we have the option for selecting pulmonary function test. Okay, and so just remember that you're going to have your MIR and the turbine and the filter, ready to go using a gloved hand. Now we're going to be able to choose between one of 2 maneuvers to provide an assessment. So I'm going to talk about both of them and then we'll do the demo. The expiratory maneuver uses the Global Lung Function Initiative, so the GLI, calculator for predictive norms. There's no inspiratory measures for spirometry available. Okay, and so the Global Lung Initiative uses 4 very specific criteria: age, gender, height, and ethnicity to run it through the algorithm to see where the patient's actual FEV1, FVC percentage matches up with their predictive norm. As per the American Thoracic Society and the European Thoracic Society and American Family Physicians, spirometry interpretation to determine a suggested ventilatory impairment pattern does not use inspiratory measures. And there's actually a 2021 article from the ATS, the ETS, that on spirometry interpretation, expiratory airflow is generally assessed by spirometry, with the most important indices being the FEV1, FVC, and the FEV1 FVC ratio. When we talk about the expiratory-inspiratory maneuver, the flow volume loop graphs that use both expiration and inspiration, they visually represent the full breath cycle, and they can also reveal information that adds to the entire clinical picture. So example, someone with an obstructive lung disease may show a characteristic scooping or concave shape on the curve above the x-axis. You know, the severity of the obstruction may be seen from the depth of the scoop as well. Restrictive lung disease may show the loops just with overall reduced volume and shorter exhalation times on the curve below the x-axis. So that's the difference between expiratory maneuver as well as expiratory-inspiratory maneuver. We will now move on to demonstrating the expiratory maneuver. So very important here, it does give you the opportunity to review the patient details. And so this is really important. And you will see that the global index, so age, height, ethnicity, and gender are required for this test. Okay. You also have the opportunity as the clinician to write notes in under current status and all of that, but we're going to move right to going ahead and saving this patient details information. Dan has reviewed it. Okay, so this should look familiar. This is from the PowerPoint. Gives the instructions for the expiratory maneuver. Based on your assessment, if the patient has the ability to read and understand, certainly give them the time they need. You can walk them through it, again, allowing them time to process. You know, we always have to say, right, the objective data can only be valid when the clinician adheres to the correct procedure below. As much as possible, we want the patient sitting with upright posture. You can apply a nose clip. It is optional, and you'll guide the patient as follows, right? So again, Dan, I would like you to close your lips around the mouthpiece. You're going to inhale quickly and deeply. And then without hesitation, you're going to blast your air out. And we want you to try to get to the 0 on the timer. So as Dan moves down, you'll see then, right, remove the mouthpiece. We're going to tell Dan to just breathe comfortably until the next trial. When ready, we're going to cue Dan to prepare for his next trial. We want to repeat the procedure until at least 3 acceptable trials are achieved. It can take up to 8. Okay, so I just want everyone to be aware of that. So after pressing continue at the bottom of the screen, you can move right into starting the test on the next screen. But please note, next to the continue button, there is a warm-up button. So if you feel like your patient needs, you know, one practice to see it before you start the assessment, you would move to warm up. We are now going to move on to continue. Start test. You're going to instruct your patient to inhale as deeply as they can and then blast their air out. Okay, so we're going to go ahead and start the test. Okay, so when the timer begins, please begin your deep breath in. So the patient is inhaling. He's now blasted that air out. Okay, so trial completed. We're going to help Dan remove the mouthpiece. I want you to breathe comfortably for at least the next 30 seconds before the next trial. Okay, and so obviously for demo purposes, Dan, you're ready. I want you to inhale deeply. Okay, keep blowing. Blow it out as much as you can. You can do it. Okay, and we're going to remove. What I do want you to know before we start again, the target and actual bars. So the target bar in green is based on the Global Lung Initiative's predicted norms. So I can't remember. I think the patient Dan picked is like a 77-year-old man. If Dan is not 77 and he's in quite good shape. He's not the height that was listed either. I'm not going to give them out your height, Dan, but Dan is not the height, but he's clearly healthy. He's able to get to the actual, no problem. With some of our patients, they will see the target and we want to encourage them to, really get that air out. You may just see that little orange bar go up a little bit. Okay, so we're going to get our third trial now. So Dan has inhaled. And he's blown out forcefully. Piece of cake for him. Okay, so it only took us 3 trials. Dan did 3 trials. You'll get the information. Your assessment was successfully completed. We now want to have the patient remove the mouthpiece and we'll instruct them to breathe comfortably. And then we can go to see results to view the full assessment report. Right. So Dan was not born in 1948, and I can tell you he's not 5'10". That'll be our secret, though, between Dan and I. So I just want to note you could, under positioning and previous assessments, can put that in the notes, right? We would like to see sitting, upright posture supported. Other information, because Dan has signed in with his registered email and password, it shows that he's the assessing clinician as well as the date and time of the assessment. And this is just some interesting information that you can see when we look at the volume time curve. The gray is what is predicted. The blue is actually where Dan went. So again, clearly the patient we picked is much healthier. So the repeatability grade, among all the trials, the repeatability grade is determined for the set of maneuvers and separately. So the repeatability criteria is applied to the differences between the 2 largest FVC values and the 2 largest FEV1 values. So if you click on the little question mark icon, it will show you what the repeatability data metrics are and why you would get an A, B, C, or below. Okay, so we really want, up in that top. But so when we look at the outcome measures, we'll see trial 1 and 2. And again, the question mark icon, whenever you click on it, it gives you information if you have a question. So it picked the 2 best trials. And then we will now go down, and now it's telling us. And the big number we're looking at is FEV1 FVC percentage. Okay, so based on the information that was inputted for the patient, 78-year-old male at 5'10", I can't remember the ethnicity, but Dan, you'll see in his demo, he did 101% of predicted. No problem, right? Some of your patients you will see, right? The predicted was 75.5%, and you may see 70%, 69%, or even lower. Okay, so this is a patient, no symptoms, no issues. He received over 101% of predicted. Even further, because of the algorithm and the software, you can go down and you will see, and this is not a diagnosis, but it is suggested pattern and severity level. So based on the Global Lung Initiative. FEV1, FVC ratio for our demonstrator today was normal. FVC was normal. The suggested pattern was normal. And the severity is not applicable because he did have a normal pattern. And so I always love this next piece because it does remind you how the software platform got to the interpretation. And so it's telling you the validity of the pulmonary function test. It's giving you that, the analysis of the ratio. Okay, and so the gold criteria, he's over the 70%. So it's great. So those are just kind of giving some explanations. This comes up automatically for you. So, I do always recommend just going in and just making sure, just, always double check. But you'll see those spirometry summary notes for your patient with the actual data. You are able to add notes if you wish. If the patient does have a noted pattern of something, we would write it in there, right? Notes suggest obstructive pattern will, to notify nursing, therapy to begin deep breathing exercises, pursed lip breathing, energy conservation techniques, whatever the prescription will be. You're first going to save your record to ACPlus. Okay, so once you click on it, you'll see that the data has been saved. Great. Okay, I'm gonna have Dan go ahead and click on it, but certainly if he was less than that 70% predicted ratio, we absolutely want to go to next assessment because we can schedule it from here. So we're going to go ahead and have Dan go ahead and do it. And the recommendation is 7 to 10 days. So Dan can either choose 7 days or 2 weeks, or even put in the actual date. Okay, and so if we're going to assign this follow-up date, we'll select assign. Okay, so it was assigned. You can email the record to the physician. Okay, so we can do that. This is what the physician will see. Okay, so they'll see the graphs. All right, this is fantastic. All the data that you collected will be emailed. Dan, go ahead and click email assessment and you can send it to me. So while this is loading, we want to make sure that you save the assessment to ACPlus. That's the first step. If your patient meets the criteria to have a follow-up assessment, please schedule that. Then if part of your process is to email the physician, you want to go ahead and you can do it right from there. And go ahead and confirm. Save to ACPlus. Important if your patient meets the criteria where we want to schedule a next assessment, we can email the record to the patient's physician. Dan's going to discuss generating a progress note and how to follow those steps.
So in this section, you can generate a progress note by clicking the Generate Progress Note. It will provide you with the data that you did. However, just note that you can also create a progress note even if the client was not able to complete an assessment. So in that progress note, you could document that you attempted an ARA, however, client was unable to complete because of fatigue or whatever other reason there was, and you can still generate that progress note, save it to ACPlus, and then send it to the electronic medical or health record.
And also please note on the progress note, you can change the skilled time there. You can move that timer if it took you 15 minutes, whatever amount of skilled time that you use, usually in that 10 to 15 minute range, but go with that. You can put in short-term goals, long-term goals, and save in this way. Dan is going to back out of the actual ARA demo to get back to the dashboard, because we do want to show you, if you need a little reminder or you just need a little bit of assistance, where you can see some other tutorial videos. So on the dashboard, Dan went to the hamburger icon, the 3 horizontal lines at top, and you can see there's contact customer support, and you will see third down, video tutorials. So if you click on video tutorials, you will see the tutorial videos that are available for viewing for our users, level 1 to 7. That is located on the dashboard under the hamburger icon, the 3 horizontal lines. Thank you very much. Hope this is a helpful resource as you move forward with doing ARA assessments and reassessments. Thank you so much.